Well, hello, everybody, and welcome back to Together in Parkinson's, our monthly podcast to bring you the latest research, lifestyle tips, and information about improving quality of life with Parkinson's. I'm Eileen Lynch, the Executive Director of Parkinson's Resource Organization, and today's conversation was sparked when I encountered a research paper titled Time is Health: Management of Parkinson's Disease in Primary Care. I was immediately intrigued for a few reasons. One, over and over, I hear from new constituents about their frustration with the process of getting diagnosed with Parkinson's disease. They tell me, oh, I was diagnosed a few years ago, but I've had symptoms for 5. Or my PCP told me my symptoms were the side effect of chemotherapy, of heart disease, of aging. And 2, we know the mountains of research indicate that early exercise and early interventions slow the progression of Parkinson's. Now, Parkinson's is a neurodegenerative condition, and there is no known cure. However, the earlier and the more consistent you are with treatments, the more likely you are to see a lengthening of stages 1 and 2, where you still have a lot of mobility and freedom. So if getting a diagnosis is a pain point, and delaying diagnosis causes a swifter decline in quality of daily life, you better believe I wanted to learn more about this new research. I immediately contacted the author of the paper, Dr. Sabine Bayen, who joins us all the way from Lille, France. Dr. Bayonne is a general practitioner or primary care physician in a rural community that has a high incidence of Parkinson's. Dr. Bayonne has a special passion for Parkinson's. In addition to her research on diagnostic delays, Dr. Bayonne has investigated many aspects of living with Parkinson's, from improving care coordination to the benefits and pitfalls of online Parkinson's forums, even studying incidents of domestic violence among men with Parkinson's disease. Dr. Bayonne brings a rich, hands-on experience of Parkinson's, and she's worked with global Parkinson's superstars like Dr. Bas Blom and her boss, Dr. David DeVos. You might have heard of him. He developed a novel treatment for Parkinson's that involves a pump that delivers dopamine directly to the brain, sort of like how a plant is watered drop by drop. That formulation is not available in the US, but is approved in Europe. Dr. Bayonne has a really unique vantage point of being a primary care doctor. She sees it all, and she knows how easy it can be for primary care physicians to overlook obvious signs, symptoms, and solutions for Parkinson's. And if it seems like I'm talking more than usual today, buckle up. I had an incredible conversation with Dr. Bayonne via Zoom a few weeks ago. And unfortunately, much of that conversation was corrupted by an audio distortion that we did not discover until after I started to review the recording. So today I'll be summarizing the main points of our conversation. I will be interpolating a few key quotes that myself and our brilliant video editor managed to rescue, and talking you through some of the slides and papers that Dr. Bayonne was kind enough to share with me. And a few quick notes before we get started. Dr. Bayonne is French. You will hear her refer to GPs or general practitioners. That translates to primary care physician or PCP in American. And you will also hear her refer to care players. By this, she means professionals involved in the care of a person with Parkinson's, which is distinct from care partners. I will absolutely be stealing this phrase for future use. So let's get into it. My first question for Dr. Bayonne was simple. What drives your interest in the treatment and care of people with Parkinson's? As a general practitioner, she can be curious about so many things, and yet she chooses to invest her time and energy into improving care outcomes for the Parkinson's population in particular. So why? According to Sabine, it's a combination of fascination and satisfaction. This is a direct quote. She said, "I'm so fascinated by the improvement after optimization of personal treatment, whether drug or not drug-based. When you see people struggling, working, eating, sleeping, and you modify treatment and you involve the caregiver, even 2 weeks later, I see them coming back, walking better, the smile is coming back." And she says, when you deliver the patient, you also deliver the caregiver.
Yes, even just talking about it, it gives me some goosebumps, because if you really change you can always improve at least health-related quality of life. Of course, we know, unfortunately, today Parkinson is not currently curable, but there are a lot of hope and research ongoing, but we can really help in different ways and from different sides, not just for there are GPs, the speech therapists, and the physiotherapists and the neurologists. But as a GP, I guess we have underestimated and a bit invisible. We have a privilege. We know it. Our patients know it, but maybe the other healthcare provider don't for the moment, because it is a privilege to accompany a whole family, as you said, from the cradle to the grave, because they trust us and we have all the elements, we have all the pieces of the puzzle to really help them effectively.
At our Parkinson's support groups, we often talk about the importance of building a care team, which includes your neurologist, your PCP, your physical therapist, your speech therapist, maybe your in-home caregiver, and so many more. A good primary care physician will bring the same amount of passion to your care as Dr. Bayen brings to her patients. One sign of a good doctor is curiosity. Dr. Bayen's curiosity is what brings us together today. I asked her to tell me more about her recent study investigating diagnostic delays in Parkinson's. The paper itself, which is linked in the comments below if you are watching this on YouTube, and in the show notes if you're listening on Spotify or another podcast device, is an exploratory, cross-sectional, retrospective observational study. What does that mean? This study looks into something that hasn't been heavily researched before, so exploratory. It looks at a single point in time, cross-sectional, and in this case, it's 12 months between 2023 and 2024. It looks back at patient files, so it's retrospective, and it observes data without interference or experiment, observational. She's not telling doctors what to do or how to treat their patients. She is looking back at how doctors acted towards or treated their patients and drawing some information from that. The research looks at the diagnostic pathways for Parkinson's disease. So how long does it take to receive a formal diagnosis and begin treatment? What steps are taken during that diagnostic period and by whom? And what are the nature of any significant delays? What Dr. Bayen and her team discovered is that most delays are attributable to the non-specificity of initial symptoms, challenges at accessing neurologists, and finally, the frequency of unnecessary complementary exams to confirm the diagnosis. One of the main changes, and this is those non-specificity of initial symptoms that I just mentioned, one of the main challenges is that the prodromal stage of Parkinson's is virtually invisible. We're going to talk a bunch about the prodromal stage. When motor symptoms appear, though, you can estimate that Parkinson's started 10 to 15 years earlier. Here's Dr. Bayen with more.
As I told my patients, I tell them like this: prodromal stage of PD is a bit like a plant growing under earth, and so just not visible, but we have to treat as early as possible to preserve autonomy and the mobility and the life, the quality of life. And
prodromal symptoms include constipation, sleep disturbance, depression, even trouble with urgent urination. Taken apart, these are unique discomforts, and taken together, they start to look like Parkinson's. The problem is that we don't often take them together. Sometimes we're not honest with our primary care physicians. Sometimes we're just not really thinking about these various discomforts as something worth bringing up. But importantly, the earlier you start treating Parkinson's, the slower the symptoms progress. Yet most people with Parkinson's don't receive a diagnosis until motor symptoms appear. That the motor symptoms might be things like facial stiffness, changes in handwriting, the telltale tremor, balance changes, maybe shuffling, you're shuffling your feet when you walk, or your loved one starts to notice that you're a little off balance. Maybe some falls trigger a visit to the doctor's office. As Dr. Bayen began treating more people with Parkinson's and learning more about the disease, she started to realize that the existing diagnosis process was a major loss for her patients. Those prodromal symptoms that we talked about, constipation, emotional changes, sleep disturbances, were not getting reported or viewed as Parkinson's. And so it took until there was a fall or until there was a tremor to really get some attention just to begin the process. So this is a direct quote again. If all these people with motor symptoms have had Parkinson's for 10 to 15 years, this is a loss of opportunity for them, says Dr. Bayonne. She began to ask her own Parkinson's patients, what was the start? Through these discussions, patients would start to mention things like, oh, I had these memory problems. Oh, I've had constipation all my life. Oh, I've had some really bad nightmares. Dr. Bayonne decided to expand the research beyond her own practice and to kind of estimate and objectifies these delays to figure out really what's going on outside of the anecdotal, what is actually happening in the average doctor's office to get a diagnosis of Parkinson's. The research team produced a survey looking into when patients reported symptoms, when the PCP began to suspect Parkinson's, and when the patient was referred to a specialist.
And so we had finally 51 patient files completely included, like a calendar. It was tricky to analyze these numbers because it was all of dates. And it was tricky because sometimes people already had another GP before or changed GPs, and then we had some negative values, but it is all explained in the article. So for the fans of numbers, they can read it in the article. But this is really, it was really pragmatic. And then I was really shocked about these delays.
So the research revealed 3 major delays. There's the patient delay, there's the diagnostic delay, and then there's the treatment delay. At first, the patient and or the PCP are unsure what they're observing. Patients may try to explain away their symptoms as stress, life events, fatigue. Sometimes they ignore or deny symptoms. You know, this sense of what I don't know, what won't kill me, or if I don't look it in the eyes, it's not there. So symptoms that might be causing discomfort in their life, they simply choose not to engage with. I'm sharing a slide on my screen. One thing that jumped out to me during our conversation, overwhelmingly, the first symptoms reported by a patient to their general practitioner were mobility symptoms. 88% of patients, the first symptom that they mentioned that triggered a conversation about Parkinson's was a movement symptom, like falling, shuffling feet, balance issues, or tremor. The vast majority of prodromal symptoms go unnoticed or unreported. The secret of the prodromal stage, says Dr. Bayonne, is to be alert to combinations within these non-visible prodromal symptoms. And again, the big few there are constipation, sleep disorders, urgent peeing, anxiety, depression, etc. So this requires, to a certain degree, patient education. And one more step, for patients to share this information with their PCP. Dr. Bayonne brought up trust quite a few times over the course of our conversation. People who have long-running and positive relationships with their primary care doctors are more likely to mention these kind of disparate quality of life symptoms that may actually be a big neon sign pointing at Parkinson's. Again, if you experience constipation and you experience trouble sleeping and you experience some anxiety and depression, those 3 symptoms don't necessarily mean that you have Parkinson's, but if you mention them over the course of a few visits or even in one conversation, it should trigger some thoughts in your doctor's head about what are we really looking at here. So that brings us to our second delay, the primary care physician. Often, when symptoms are observed or mentioned, the PCP may delay diagnosis to observe the evolution of these symptoms. You know, will they go away? Are they caused by medication? Will they get worse? Is it just stress? However, when motor symptoms appear, says Dr. Bayonne, most primary care physicians are quick to take action. According to her study, that action takes place within a month. But again, that's the motor symptom. And what we mentioned earlier is that When a motor symptom appears for Parkinson's, that person has likely had Parkinson's for 10 to 12 years beforehand. So we've arrived at this point at the third delay, the diagnosis and therapeutic delay. Very often, patients wait weeks or months to see a specialist after they've had that conversation with their primary care physician. This could be due to shortages in access. Certainly, we know there is a shortage in movement disorder specialists in the US. And this could also be insurance restrictions here. Sometimes it's really hard to get the approval you need for the doctors you need. In Dr. Bayonne's study, 70% of the patients referred to a specialist, which would be a neurologist or a movement disorder specialist, from a general practitioner, received a quick confirmation of Parkinson's. So by the time we get to this third step of diagnosis, which is the specialist, 70% of the people in her study in France did receive a quick confirmation, which leads then to a quick beginning in treatment of getting on those medications or starting treatments and therapies. But another 30% were sent for further testing. This may look like an MRI or a CAT scan. It may look like DAT scans. That's a scan that's looking at the dopamine levels in our brain to compare it to a healthy brain and determine what's going on. There's more studies more recently. There's a skin biopsy test and a few others in the works. But ultimately, what these do is they delay the onset of treatment. Sometimes we need them to really confirm the diagnosis we're looking at. But the medical process moves slow. So if we've already waited a really long time to talk to our doctor about our symptoms, if our doctor chose to observe those symptoms for a little while before moving you on to a neurologist, if it took 1 to 3 months to schedule an appointment with that neurologist, further testing is just simply kicking the ball down the road. And again, I'm not saying it's a bad thing to conduct further testing. What we're talking about here are diagnostic delays and the ramifications of those. So for those of you watching on video, I did just share another slide. Dr. Bayonne showed this visual from her study, and you'll notice something pretty shocking. Over time, these delays from the very start, the very first observation of a symptom to the beginning of treatment, adds up to 998 days, again, between a patient first noticing a symptom and getting that first prescription. So that's well over 2 years for a disease that responds best to early and consistent therapies and interventions. Again, between the first observation of a symptom and that first day of treatment, we're looking at 2.7 years. And we know that early and regular treatment of Parkinson's slows the progression of those early stages.
Sometimes care players says, yes, but as far as Parkinson is not curable for the moment, we have time. But I say, that was the title, time is health, because, okay, we have time because we have no current definitely cure, but it is question of quality of life, time of quality in quality and of life. And that is why we have to act. And 6 months with pain and feet in the morning when they get out of bed and have the sticked feet and the fear and the uncertainty and skipping holidays because they say maybe neurologist will give me an appointment, and so this is unbearable. And so we have to. That is really my mission. I want care players to imagine this, just the pain and the fatigue and during 6 months. It is still too much.
So as you can see, Dr. Bayonne feels very strongly that diagnostic delays cause unnecessary pain and suffering for people with Parkinson's. But in terms of disease progression, what's the real cost? If we are able to reduce these diagnostic delays, what would that mean for the average Parkinson's patient? I asked Dr. Bayonne, and her answer was decisive. She said, this is a quote, "It's a virtuous and vicious cycle. The more we wait for diagnosis, the more we lose hope. And hope is the motivation that drives us to use functions that are still usable."
The big difference will be that more you wait, more you lose time, waste time, more you will go down in this negative, vicious circle. But if you win time, so you can bring back mobility, the smile, the daily life, going back to work, And so then you engage it the other way around. You engage where the positive circle.
It's important to note that many positive lifestyle interventions can be incorporated before a positive diagnosis. Regular and rigorous exercise, healthy diets full of fiber, antioxidants, and fresh fruits and veggies, implementation of a regular sleep routine, even if you don't feel like you're getting great sleep out of it, many other minor or major tweaks you can make to your own life to improve it and to help slow this progression. But pushing yourself to do all of these things while waiting for a diagnosis, it really feels a bit like shadow boxing. It's hard. And on the flip side, it's harder to get back something you've lost than to maintain something you've had. So one of the most significant diagnostic delays is simply that apathy and that depression that creeps up as we wait for an answer that in many ways we're dreading. So what can we do about these diagnostic delays and their accompanying challenges? Dr. Bayonne is full of ideas, and in fact, she sees her research as a guide of sorts for PCPs.
And that is also the point. When GPs participate in such studies, it is kind of training already. And
Dr. Bayonne's work specifically investigates the importance of a multidisciplinary team to treat Parkinson's. We've included a link to her paper, Improving Person-Centered Care Coordination by Interdisciplinary Communications and Teamwork with Patients. Sounds like a mouthful, but it's a great paper. It's looking at how the various team members, and we talk about team members all the time at Pro, how the various team members can communicate better amongst themselves and with patients to improve outcomes. Her work also encapsulates how beneficial the PCP, that primary care physician, can be when properly trained to spot early signs of Parkinson's, and how destructive that person can be when untrained or unaware. And I have heard this in support groups many times. People say, well, I was told that this is just an essential tremor, or I was told that this is just based on a medication I'm on. And that is a loss for people with Parkinson's. Dr. Bayonne says better training to recognize the signs of prodromal Parkinson's is critical. She suggests a public awareness campaign that simultaneously educates the public and general practitioners. Campaigns like we see for colon cancer or breast cancer or other widespread diseases that can be reasonably treated with early detection. This could be something, as simple as, flyers at the doctor's office, or ads on a bus or subway. If you see these 4 symptoms, ask your doctor about Parkinson's. Dr. Bayonne also works within her own community of practitioners to engage and educate them on early Parkinson's. And in her words, she does hope that this effort will spread out. I'll be honest, it got me thinking about how Pro could engage our own local health centers to train our generalists. And I have plans for about a dozen programs that we don't have the capacity to execute yet. But there's a lot more we could do. And this is maybe a conversation that each of us has with our neurologists or primary care, or our neurologists or our primary care physicians. How much do you know about Parkinson's? How much do your colleagues know? What information can I share with you from my own experience? So whenever I interview someone, I like to ask them if they see a reason for hope within the Parkinson's community. Given that it's the fastest growing neurodegenerative condition in the world and still doesn't have a cure, sometimes the outlook is grim, and it's a lot of work. At one point in our conversation, Dr. Bayonne did describe Parkinson's as a rock in your backpack. Over the course of life, we've got this invisible backpack and it gets filled with trouble. Maybe we have a loss or a divorce, or we lose our job, or we experience a financial setback. That's all adding weight. And Parkinson's is one more weight that you are throwing into that invisible pack that every single one of us has. So given that we've got this extra rock and it sure is heavy, is there reason to hope?
Yes, and research is ongoing and really promising. And what is important in our context for time is health, the earliest we start identifying, diagnosing, the earliest we can propose treatments, and then we can still with the current treatments we can save quality of life for at least 10, 15 years, according to the stages, we discovered the disease. But so trust the future and the research and the teams like Eileen, who do a super job.
Parkinson's is like a silent plague. 30% of people with Parkinson's will never tremor. And the number of people with Parkinson's is expected to double by 2030 from its existing rate in 2015. That means over a 15-year period, the incidence of a common neurodegenerative disease is doubling. That's really significant, and it continues to accelerate. You might have heard of Dr. Ray Dorsey, who came out with who's written a few books about Parkinson's. He describes Parkinson's as a pandemic. And because general practitioners are a patient's first recourse, they must be able to detect prodromal symptoms. Until there's a cure, that's our best fighting chance to slow progression and improve quality of life with Parkinson's. You know, the number one takeaway for me in this conversation was the importance of the PCP in early diagnosis and in accompanying you along every stage of Parkinson's. Make sure you have a great GP. If you're lucky, you will have someone like Dr. Bayonne. We'll make sure we're educating our GPs and the people in our network, and I hope that you do too. It is a team effort, and we are on your team. So don't forget to like this video and subscribe if you would like to see more content like this. There are plenty of notes and links below this video if you're watching on YouTube, and in the notes if you are listening on Spotify. I've included all of Dr. Bayonne's papers, and they are both fascinating and accessible to the average person. I want to remind you that Parkinson's Resource Organization is here for you. You are not alone. Please take a minute to engage with our other programs. We've got virtual and in-person support groups. We have an amazing resource directory, a monthly newsletter in addition to this podcast, and a wealth of information that we're always happy to share with you. All of this information is free to you, and it is only possible through the generous support of our community. So if you'd like to make a donation to keep these programs free, you can always do that at parkinsonsresource.org. In the meantime, happy reading, happy listening, and we will see you next time. Thank you.